Hi Alex, how's it going?
Good, thank you. How are you?
Good. I just would like to thank you for doing this interview for me. I really appreciate it.
Of course. Thank you. I was flattered that you asked me, so thank you
Yeah,
for
no
allowing me
problem.
to help.
No problem. I know I can get a little awkward. I just have a
Okay.
little 5 questions to ask you.
Sure.
Is that okay? First, tell me a little bit about yourself.
Well, my name is Alex Roberts. I grew up on the central coast of California. I moved to Arizona about 8 years ago, and I work as a physician's assistant at a family practice doctor's office up in North Scottsdale.
Cool. And why did you want to become a physician's assistant?
I think other than the obvious answer of wanting to help people, I had a pretty bad accident on my dirt bike when I was a young child, and that involved a lengthy recovery process. And during that process, I interacted with the physician's assistant. I really looked up to her. I thought she was cool, and it just kind of got me interested in that career path. So I think that's probably the catalyst.
That's sweet. And third one, explain me the process of becoming a PA.
Sure. So, of course, you have to complete your undergrad, ideally in a medical concentration. I did health sciences. A lot of people do biology or some other pre med major. And then during that time, you want to volunteer or work at a doctor's office because PA school does require a couple letters of recommendation. So, you want to get those, apply to PA school. Once you're in PA school, some clinicals are involved. It can be rough. And then afterwards, you take your certified exam, and then you're certified as a PA.
Sweet. What are some cons you think as far as being a PA?
Some cons. I would just say sometimes being in the medical field can be frustrating because you try to help your patients, but once they leave, it's in their care. So sometimes that can be frustrating. Otherwise, I think the only con I can think of is sometimes I do more than the doctors and I'm not compensated as much as them. But, I chose to be a PA and not finish the medical school path. So it's not, I guess that's not really a con.
That's totally understandable. And last one, if you had any advice for a student becoming a PA, what would it be?
Advice, just keep your head up. I know sometimes it can be really difficult. There are times, during your undergrad and during PA school, the course load is really difficult. It can be very, very trying, but I think that you just have to keep soldiering on. There is light at the end of the tunnel, and it will be worth it once you finish. So I think that's the advice I'd give any student, but specifically a PA student, it's a pretty difficult education path.
All right, well, I appreciate you doing this for me. Thank you.
Of course. Yeah, thank you.